And what has really given me a lot of joy with working with doctors, gynecologists here is everybody's welcoming, everybody's friendly, everybody wants to learn, and they've been very, very supportive. But I'm very happy for you to welcome me to come back and help anytime. My name is Mr. Alexander Oboh. I'm a consultant gynecologist currently working in the United Kingdom. I work for the Mid Yorkshire Teaching NHS Trust, which is a hospital in Wakefield, close to Leeds in the UK. I have been invited to Rwanda by the Rwanda Legacy of Hope charity, and this is my third health tour to Rwanda. I've done previous tours in Kigali, and this is my first one in Butare. I'm here for the week, so I spent on Monday seeing all the patients that we plan to work with during the week. I'm a gynecologist, so and my special area of interest is in minimal access gynecology, which is keyhole surgery in common words. So I've seen patients who have fertility issues. These are women who've been trying to get pregnant but are unable to get pregnant because they've had issues with their fallopian tubes, and that is the tube that has to be open for the egg to meet with the sperm for the babies to be formed. So I have had what we call a pre-op assessment, so a discussion with the patients to know what their conditions are and what the patient wants, so they have an agreement on what we can achieve with surgery. So we plan to do 3 patients every day, but for Friday. And that's because I've got to leave to Kigali to catch my flight back. So in total, I've seen 11 patients on Monday to talk to them about surgery. We started surgery in earnest yesterday. We did 3 cases, and I've got 3 others planned for today. So all the women so far have had problems with their blocked fallopian tubes. One of them had a fibroid, so we're taking the fibroid out, and hopefully you would hope that they would be able to achieve a pregnancy in the future on their own. So I think for me it's still the same thing about having to prevent disease rather than treat. So you get your fallopian tubes blocked for different reasons, and the most common reason is an infection. So you can have an appendicitis that doesn't get treated on time, that can cause infection, that can affect your fallopian tubes. You can have an STI, that's another word for a sexually transmitted infection that can block your tubes. You can have previous laparotomy, which is abdominal operations for any other condition like your bowel condition, and they will cause you to have adhesions that can block your fallopian tubes. So if we can get things right the first time and avoid the blocked fallopian tubes, that would certainly stop me doing any work. But most importantly, for some patients, unfortunate that I can't do anything, so I can't even fix the blocked fallopian tubes. And for those patients, their options are limited to having just keyhole surgery. And if that doesn't work, then you're looking about IVF treatment, which is in vitro fertilization. I know in Rwanda, it's still a developing kind of healthcare practice for IVF. It's expensive, I've been told, in Rwanda, just like in any part of the world, it's still expensive. But that would have to be the option left for women who have blocked fallopian tubes, and we can fix that. I've just been in Butare for 2 working days, but in the last tours when I've been to Rwanda, I spent time in Kigali in CHUK. And what has really given me a lot of joy with working with doctors, gynecologists here is everybody's welcoming, everybody's friendly, everybody wants to learn, and they've been very, very supportive. So like the team here, I've got Martine, who's our theatre nurse. She's been fantastic. I've got Jean, which is Dr. Muturaze, who's the head of the department here. He's been great. Yesterday, Eric, who's the matron, had to come back to pick me up and give me a ride to go back. So everybody in the hospital staff have been great to me. And the food, I'm learning to adapt to the food. It's different, but I'm trying to enjoy it. So I think the future for me with this work is that I can support and share my knowledge with local gynecologists. And the team in CSUK have done extremely well. I know the last time when I look at the operation diaries, they're virtually operating laparoscopic surgery almost every day independently without me. And I think Rwanda now has the Center for Minimal Access Surgery in Africa in ICAD in Kigali, which will be very good for all your gynecology trainees and consultant gynecologists to have the opportunity to get trained there. And so you can have your own well-experienced and skillful work staff. But I'm very happy for you to welcome me to come back and help anytime.